We will talk about fatty liver. Fatty liver is extremely common condition. It affects around 30% of world population. Fatty liver means when fat is accumulated into liver, and it's problem because fat causes inflammation into liver cells, and it causes damage of liver cells, and this damage in time becomes irreversible, and fibrosis and cirrhosis is developed. So fat is problem because it causes inflammation into cells. And what are the 5 most common symptoms of fatty liver? First symptom is fatigue. Fatigue, even person rests adequately and person feels tired always. Why it happens? It happens because when liver cells are not functioning properly, they have lack of energy because their energy production is decreased and person feels tired. It's important because fatty liver decrease production of energy, decrease function of mitochondria, and mitochondria is powerhouses of our cells, and they producing ATP, and ATP means energy for our body. And second most common symptom is pain and discomfort into upper right part of the abdomen, and person feels dull pain usually, and discomfort. It's not sharp pain, and it is caused because inflammation causes swelling of liver tissue, and it causes tenderness. And also when liver is enlarged because of fat deposition, it presses adjacent tissues and causes discomfort and pain sensation. And third most common sign is elevated enzymes into blood, especially ALT and AST. And what means they are enzymes, they are proteins, and they are formed into liver cells. And when liver cell is damaged, these enzymes are leaked into bloodstream, and that's why we have elevated level of ALT and AST. ALT is alanine aminotransferase, and AST is aspartate aminotransferase. And AST is not specific for liver because even muscle injury can cause elevated level of AST. So ALT is more specific for liver, so ALT is sign of liver problem, liver inflammation, and it can be very early sign of liver problem and fatty liver. Fourth most common symptom of fatty liver is jaundice or yellow skin and yellow eyes. It happens because normally red blood cells are break down into bilirubin, and from bilirubin bile is formed. But when liver is dysfunction, liver is unable to create bile from bilirubin, and this bilirubin leaks into bloodstream, and this bilirubin is yellow, and it's accumulated into skin and into mucous membranes and causes jaundice or yellow skin and yellow eyes. And fifth most common symptom is swelling. Swelling usually legs. It happens because liver is unable to produce enough proteins, and proteins are important to maintain balance of fluid into blood vessels. And when there is lack of proteins, fluid leaks from blood vessel into tissues, and we see it as a swelling. So swelling legs and even swelling of abdomen, which is called ascites, is common symptom of liver dysfunction. It also late symptom of liver dysfunction. So jaundice and swelling is late symptoms of fatty liver, and if fatty liver progress, it can progress into cirrhosis or fibrosis, and they are very serious conditions of liver. And why we pay attention fatty liver so much? Because eventually they increase risk of heart attack, they increase risk of stroke, and they increase risk of liver cancer. That's why fatty liver is important to diagnose and manage adequately as soon as possible. And what causes fatty liver? First and most important cause of fatty liver is obesity, especially abdominal obesity, and diabetes and insulin resistance, also important cause of fatty liver, and high triglycerides into bloodstream and lack of physical activity is very important. Alcohol intake and viral hepatitis and viral infections like hepatitis C also causes fatty liver. And now let's say about treatment. Weight loss is important, especially if you weight loss 5 to 10% of your body. It will improve your liver condition very importantly and significantly. So weight loss is very important. Also exercise 45 minutes per day improves liver function importantly. Aerobic exercise like jogging or walking or cycling or dancing are very important part of exercise, aerobic exercise, and at least twice a week anaerobic exercise like weightlifting also important. Diet, healthy diet with lots of fruits and vegetables and less refined sugars is important. Less fats, also healthy fats is good and healthy, for example from avocado, but saturated fats is not considered safe for liver, especially high amount. And managing underlying disease is important, like diabetes. If person has diabetes, you should treat diabetes as soon as possible to avoid liver disease. And lower cholesterol is also very important. And from supplements, vitamin E is considered protective for liver, and milk thistle also considered liver protective supplement. It's called silimarin also. And omega-3 fatty acids have some effectiveness, they decrease inflammation. Berberine also important, and turmeric. And coffee also has liver protective characteristic, especially it protects liver prevents progress into fibrosis. That's why it's important. That's all I wanted to say. Thank you for your interest, thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.